in a developing legal confrontation that illuminates the contentious debate around transgender health care for minors. A Seattle hospital has alleged that Texas Attorney General Ken Paxton has requested detailed records of gender-affirming treatments provided to Texas minors. This unprecedented move has sparked concerns about patient privacy and the politicization of transgender health issues. According to the lawsuit filed by the hospital, it received a subpoena from Paxton's office demanding a wide array of medical records, including those related to hormone therapy, surgical procedures, and psychological services. The case underscores the ongoing tensions between states with differing stances on the treatment of transgender youth, particularly in healthcare settings. The issue of gender-affirming care for minors has become highly politicized in the United States, with several states considering or implementing measures that would restrict access to such care for young people. Advocates for transgender rights argue that access to gender-affirming healthcare is crucial for the well-being and mental health of transgender and non-binary individuals. On the other hand, some politicians and groups have raised concerns about the long-term impacts of such treatments on children. They advocate for policies that limit medical interventions, particularly irreversible procedures, until an individual reaches the age of majority and can make independent medical decisions. The request from Texas's top legal official reflects an escalation in the national debate and has legal experts considering the ramifications on medical confidentiality and interstate legal authority. The Seattle Hospital's lawsuit highlights the concern for the potential breach of patient privacy and the repercussions it could have on individuals seeking sensitive medical care. This standoff isn't just a legal matter. It delves into the heart of the larger conversation around transgender rights and how government agencies interact with healthcare providers who serve a diverse community. It also raises questions about the balance between state rights and individual rights, particularly regarding the movement of residents across state lines for medical services. The Seattle Hospital is fighting to protect its patients' medical privacy, a fundamental tenet of healthcare and the physician-patient relationship. With this lawsuit, the hospital takes a stance against releasing potentially sensitive and personal medical information without the consent of the patients or their guardians. The situation is particularly relevant in the current social climate, where the rights and recognition of transgender individuals are at the forefront of many legislative and social discussions. As the case unfolds, healthcare providers, legal specialists, and advocates for transgender rights will be watching closely. They foresee the impact of the outcome not just in Texas or Seattle, but nationwide, as it may establish precedents for how medical records are treated across state lines and the extent of state power in the pursuit of such information.